yellow thing. That's a good place for the intercostals. Right down here. You've got, excuse me, a good celiac trunk, but you have the portal system there. Okay? And good too. Again, you're seeing the bifurcation of the carotid, and then this would be the external because it's giving off vessels to the head, face, and oral cavity. And then this one keep on going, so that's the internal carotid. Okay? And posterior cerebral, anterior cerebral. That's pretty much that. And over here,
Like paparazzi.
that's the arterial ligament, and that's the fossa valis. And this would be the LAD. Or I could do the great cardiac vein, which is the blue thing here. On this one, and usually what I do, you can see the holes. And what do you call them?
Lymph node.
What kind of nodes?
Salivary.
Axillary lymph nodes. Those are the ones that your breasts drain into, and that's why they go up to check those if you have a bad mammogram. Okay, so on this one, you'll get a node one. You'll probably get, oh, here's a nice thoracic duct, and then on lymph nodes, let's see what else. Oh, this one is mainly the reason why I even bother to pull this one out. What do you call this? See this vessel, the blue thing coming all the way up? Superficial?
Femoral. Great saphenous.
Great saphenous.
Great
And this one, you've got your nodes. That's the AV node, and remember the AV node to the AV bundle and the bundle branches are these little yellow dots in here. You have the pericardiums and the chambers are good there. Okay. And the one behind you is for the other class. Now this one was one that I really thought you hadn't put any time in, but because this is fetal circulation and you need to know this. There's two different processes going on in fetal circulation. This is the placenta. The fresh blood, the oxygenated blood comes through the umbilical vein, and that is, let me hold this little guy up here. That's in this structure, which is the umbilical cord, and this is the umbilical vein. And the umbilical vein sends part of its blood to the liver, and then the other continues as the, this is really intimidating. The ductus venosus. And the ductus venosus goes to the inferior vena cava. And then the blood that goes to the liver instead is eventually going to go hepatic vein, inferior vena cava. Just divides it, separates it a little bit. And so when it goes to the inferior vena cava, that takes this fresh blood into the right atrium. And the right atrium has a hole in the septum. It goes to the foramen ovale, right? And so the blood most of that blood's going to go through the foramen ovale into the left atrium, to the left ventricle, out the aorta, up to the head and neck area, okay? At the same time that's occurring, there is some that's in the head and neck area that's returning. It's partially deoxygenated. So it comes through the superior vena cava, goes into the right atrium, and it does go to the right ventricle. Goes out the pulmonary trunk, and that's what that other one's for, the ductus arteriosus, from the pulmonary trunk to the descending aorta. Can you see that over there? So that means this partially deoxygenated blood is going to go down the descending aorta. Because see, this is where it is, pulmonary trunk. That's a vessel. It goes there. It goes down. Eventually, it's going to take blood to all these areas that aren't really working all that much at this point in the fetus's life. But eventually, it gets down to the bottom, which is the common iliacs. And remember, they divide into internal and external branches. It goes to the internal iliacs, and they give off the umbilical arteries that take the blood back to the placenta. Okay, some of these things, and some definitely be tagging is the foramen ovale. There's a hole in this baby's heart. where the blood would go from the right atrium to the left atrium. Okay? So you want to check that out. Now, on this one, general heart stuff, the same kind of heart stuff is on that Heart of America, and there's a
Can you
little heart
see?
over there. So make sure you know the chambers and the valves of the heart. And over on that lower extremity, okay, you want to know femoral divides into anterior and posterior tibial, so you want to be able to look. What would you say this is right at this point?
The red or
The what?
the red?
The red, yeah, the red.
The who?
The red vein.
This is not.
I mean, the
wait,
artery.
no, this is an artery, yeah, femoral. And then the femoral is going to be popliteal, and then it's, when it's behind the knee and the popliteal fossa, and then it's going to divide anterior, posterior tibial. So what do you think that is? Here's the anterior tibial, comes to the top of the foot. Posterior tibial goes all the way to the bottom. Okay. Or I could tag it up here. What would it be up there? Y'all should know that. So it's going to be a femoral something. If it's blue, vein. If it's red, artery, okay? And the same thing for this. You should be able to figure out, you know, you have brachial artery that divides into radial and an ulnar. Okay, and here's that. This is the deep palmar arch because it's giving off metatarsal arteries. And then on this one, the same thing with the carotids. Okay. Okay, is that it? On this guy, an iliac and internal iliac, nice division there. This would be a giveaway, but what do you think these are called? Wild guess.
Lumbar.
Between the ribs. Intercostals, yes. Okay. And a femoral artery, femoral vein, and what do you think this is? Or what this represents? It's going down into the pelvic cavity.
Iliac?
No, the biggies are the iliacs.
Oh, okay.
And these are branches off the aorta, testicular, okay? These are your gonadal. What kind of what is this?
Lacteal.
It's a lacteal, so it's a capillary, right? Lymph capillary. I was telling another group, what I do is I can only manage to get a pin, just stick in between the red and the blue, so I just asked you to name the group. And considering it's located in your lower back, it's lumbar, the lumbar arteries. I think you had to know that one. Okay. And as for the and the thymus and the, oh, I could ask the spleen too. Right? Left side spleen.
And another heart.
Is there anything I've left out you can think of?
The green brain?
Oh, thanks. I do plan to ask this one right here. What's this one?
The middle cerebus.
The middle cerebral, yeah. And there's no cat. And the valves. This would be good for, yeah, this would be good for pulmonary. And I don't know if they, I don't have the key. I'd have to look at a key to see. But basically, this is the pulmonary trunk, right? And it's goes into pulmonary arteries, and the pulmonary arteries are taking deoxygenated blood, so it's blue.